take a CBCT, we're going to start inside of EzDent-i with the patient chart open. Be sure to have the correct patient chart up, as when taking a CBCT, it digitally burns the patient name into the DICOM files themselves. From there, we simply click on the Acquisition tab on the top of the screen and click CT from the panel on the left. The screen opens up to the CBCT interface to make our selections. Beginning with the gender options on the lower left of the screen, options include man, woman, and child. Note, if the patient is 12 or under in the system, it will automatically select child as the default. To the right of gender are the patient size and density settings. Options include hard, standard, which is your default, and soft. Now let's move to the right panel under the field of view section. This device is very simple to use. There is one field of view, 8 by 8. So that is 8 centimeters in diameter by 8 centimeters high. Additional image options include high resolution, which is your default, and the green setting for reduced radiation. Also, voxel-based options below this include standard for highest quality and applications allowing for a larger voxel size. Also notice the message information area across the bottom left of the screen, always displaying the status and the next steps to take. Once we have our selections made, we can simply click confirm and move on to position our patient. Before positioning the patient, ensure the mode adjustment slider is set to the CBCT mode by gently sliding the lever to the CBCT position. First, have your patient seated, sitting as upright as possible a few feet away from the machine. Adjust the chin height approximately a ½ inch under the chin by using the column up and column down buttons on the hand switch on the side of the device. Alternatively, you can use the buttons on top of the horizontal arm in front of the mirror as well. As you have the patient roll into the machine, have them hold the handrails with their palms facing up. Keep the feet at shoulder width apart for stability. Ideally, we want the patient's spine to be as upright as possible and the chest close to the device during image acquisition. With a clean vinyl bite stick cover, have the patient bite in the bite stick firmly in place. Ensure the teeth are firmly in the grooves. As a tip, pull down on the bite stick to secure the patient. Next, we focus on the mid-sagittal light and focus on getting that line through 2 anatomical points on the patient's head. One in the center of the eyes and the other at the philtrum area, so that the line is right through the center of the head. To adjust the position, move or tilt the patient's head to conform to the line. The A9 has a mirror attached to the vertical frame for both the operator and the patient to ensure they are centered and positioned properly in the device. Once we have established the mid-sagittal line position, we want to ensure the patient's upper arch is as parallel to the floor as possible. Have the patient smile and visually verify that the upper arch is parallel with the floor. If adjustment is needed, use the column up and column down buttons on the hand switch to adjust for the occlusion. Once patient positioning is complete, we can simply hit the ready button on the acquisition computer interface and the machine will rotate to capture position. Have the patient close their lips around the bite stick, tongue at rest and eyes closed. Have the patient as still as possible during image acquisition, as this will affect your image quality. To acquire an image, hold down the exposure switch, which will turn yellow once exposing, and hold. Do not let go of the switch until the image is complete.
Image capturing is complete. Please wait a moment.
Once image acquisition is fully completed, we can release our patient. The image is then saved directly to the patient's chart within EzDent-i for review. Normal chin rest with normal bite stick for both pano and CT mode. Normal chin rest with special bite B or edentulous rest for both pano and CT modes.